Hi.
How are you doing?
Good, great. I'm Shantae Breitenbach. I'm an intern at, come on back, I'm an intern at South University.
Okay.
And I'll be taking care of you today. Is that okay?
Yeah, that's cool.
Have a seat.
Okay.
First thing I would tell you is that as an intern, I have a supervisor who will also be going over my cases to make sure that I'm giving you the best care possible. So have you had a chance to look over the informed consent sheet you were given? Okay, do you have any questions?
Just a little about confidentiality.
Okay, well, let's go over some of that stuff. So confidentiality means that I'm not supposed to share any of your information, but there are some limitations. And what those limitations are is if you indicate that you're gonna cause harm to yourself or to someone else, that I have to tell someone, I have to report it. We're called mandated reporters.
Okay.
So anything about hurting yourself or someone else, child abuse, elder abuse, things of that nature.
Okay.
If you were mandated to be here by court, I'd have to tell them whatever information they needed, stuff like that. So, also I wanted to tell you that if you're uncomfortable in this situation for any reason, you have the option to terminate service. If you want to see someone else, just let me know and I will refer you out. So is it all right?
Yeah, sounds really good.
So,
So my mom can't call, I'm just.
no, your mom cannot call. And unless are you under the age of 18?
Yeah.
Okay, then no, your mother cannot call here and ask me if I even know you.
Okay.
So you're okay. So what brings you here today?
Well, I think I have anxiety.
And why would you think you have anxiety?
Sometimes for no reason, my heart starts beating really fast. I feel like I can't catch my breath, or like I can't have problems swallowing, and I just feel very out of sorts. And it just started happening, so I'm not sure what's going on.
Did you see a doctor? It sounds like a medical problem.
I did.
What did the doctor say?
That everything medically is fine, that I should maybe come talk to somebody, because it sounded like it could be anxiety. So I just decided to make the call and come talk.
So, is there any particular situations when this happens?
Well, I just had someone pass away a few months ago. And that was really hard. And slightly after that, I started feeling this way.
Is it, so it started happening right after that person passed away? Any particular situations that triggered the symptoms? Or is it just random?
It's just kind of random. Like sometimes it'll be every day for a few days, then other times it'll be, once a week.
And who was it that passed away, if you don't mind me asking?
My grandmother.
Oh, I'm sorry.
Oh, thank you.
Were you really close to her?
Yes,
How old was she when she died?
88.
So she lived a long life.
Yes.
Did she pass from any particular disease? Was it natural causes?
No, she was sick.
How long did you know she was sick?
Oh gosh. It's a long story. She has been sick throughout her life the past 20 years. It was just really bad this past year.
Yeah. So, your grandmother, who you were very close to, recently passed away because she was ill, and now you're having anxiety-like symptoms or symptoms that you feel are making you nervous, like your heart's racing and stuff like
I
that.
don't feel like I can control it.
So, what would be your goals? Like, what do you want to go through at counseling?
I'd like to make it stop. I would like to get to the point where I can do something or redirect to not feel this way.
Okay, so we're supposed to go further than this?
I think.
Well,
On a scale of 1 to 10.
do you feel those symptoms now?
It got a little hard to hear in there when we
Okay.
started discussing the case.
All right.